All right, now let's begin by talking about alcohol's effects on the body. So, one of the things that I will kind of mention, and I certainly have noticed this as I've gotten older, is that alcohol can suppress REM sleep, and generally, that can really mess with the quality of your sleep. Even though alcohol can provide sedative dosage, like sedative effects in very small amounts. But let's talk in general about what alcohol does to the body. So in general, long-term abuse is going to lead to brain damage. And basically, this is due to the alcohol, those high levels, elevated levels of acetaldehyde, liver deficiency, and the poor nutrition that will often result with chronic use. And in particular, heavy alcohol use leads to a vitamin B1 deficiency, which is thiamine. And that largely happens due to a poor diet. Generally, alcohol, as I kind of mentioned, doesn't really have a lot of nutritional aspects to it, and in high doses is an appetite suppressant. And additionally, it's critical for brain glucose metabolism. And if you are lacking in thiamine, cells are going to die. As a result of this thiamine deficiency due to chronic alcohol drinking, one potential disorder, if you were in my biopsych class, you may have heard about this. One of those is Wernicke-Korsakoff syndrome. This is associated with confusion, disorientation, tremors, poor motor coordination, ataxia, and potentially memory problems. So later stages do include anterograde amnesia, where these people can't form new long-term memories. You can do a thiamine infusion. You basically give people megadoses of B1, and it can stop the degeneration provided that alcohol use stops, but it doesn't reverse any of the cell death that happens. And in particular, you're going to see a lot of cell loss in areas of the thalamus and in the mammillary bodies, which can be tied to some of those memory issues. Additionally, what you will see with alcohol-induced brain damage, just in general, you're going to see a general atrophy. You can see that the gyri, the raised portions of the cortex, do not look as full. There's a lot more open space, and you're going to see enlarged ventricles as well. Now, let's talk about some of the effects on the heart and the circulatory system. So in general, alcohol is a vasodilator. It causes blood vessels to open. So what's kind of interesting is that when I was growing up and I watched Disney cartoons as a child, I would see cartoons where somebody was lost in the snow, and you would see a cute little Saint Bernard running around with like a little keg of alcohol around its neck. But generally, you feel warm. But because of how vasodilation works, you are actually losing heat. And this can actually be really deadly because drinking alcohol when you are already cold produces an even heavier drop in body temperature. People who are drinking and then fall asleep outside might actually risk dying from hypothermia. But one of the things that's interesting, this vasodilation can actually improve cognition in older adults. But that doesn't necessarily mean that you can drink a whole bottle of wine in your older age. We are talking maybe 1 to 3 drinks a day. Folks who do that were found to be less likely to develop dementia linked to poor oxygen supply. So generally too, low to moderate doses increase our HDL, which is our good cholesterol, and it reduces our LDL, which is our bad cholesterol. And low to moderate doses do lower heart disease risk, blood clot, and risk of stroke because of these vasodilating properties. All that being said though, It was pretty interesting a couple of years ago. The World Health Organization said that there is no dosage of alcohol that is actually beneficial to your health. So we do kind of have to try to reconcile these two very different ideas. So now let's talk about alcohol's effects on the reproductive system. And I'm going to be completely honest with you. This is my least favorite part. Now, and that's largely because I'm a prude. So it has been believed that alcohol causes and increases sexual arousal. It makes you more interested in sex. It makes you want to engage in sex. And it's going to lower inhibition. But this is largely because of expectation and a little bit of placebo effect. And additionally, there's a difference between psychological arousal and the actual body's response. So, for example, a study back in 1991 actually had male college students drink alcohol to get blood alcohol concentrations either of 0%, 0.025%, 0.05%, or near the legal limit around 0.08. And they had to watch an erotic film. And so they did a couple of different things. They had subjective report of arousal, and then they also basically they basically measured the degree of these college students' erections, both the rate of tumescence and basically how much the girth basically increased while they were watching the film. So we're kind of looking at this rate of erection here in this data. And so basically low doses of alcohol did enhance arousal. But once those doses increased, you could kind of see that things dropped off quite a bit, especially when things were kind of at the legal limit. So while it is thought, and they have also looked at this with female college students, they looked at things like vaginal blood pressure, orgasmic latency. And so these physiological measures of arousal decrease with increasing alcohol levels. Despite all of that, though, subjective levels of arousal increase. So we have people saying, oh yeah, I'm getting turned on, and yet their reproductive organs are showing very different things. So like I said, subjective arousal increases, but this objective physiological level of arousal does not. And as I kind of mentioned, alcohol does make orgasm more difficult. So this was the study that was done with female students. So we have orgasmic latency. So we have placebo, low doses, moderate doses, and high doses right near the legal limit. And you can see that just in general, it's going to be it's going to take longer to achieve that with higher doses of alcohol. And heavy use actually ends up hurting the sex organs over time. So for people who are AMAB, basically we know that you can have testicular atrophy and increased impotence. It may be harder to achieve an erection. It may be more difficult to keep an erection. Additionally, there is going to be reduced sperm production, including the shrinking of the prostate, as well as the seminal vesicles that actually produce that sperm. Additionally, if you have ovaries, it's going to disrupt ovarian function. There are going to be different types of menstrual problems. So heavy use can actually make sex more unpleasant, despite the fact that people tend to believe that it makes sex better. It seems like heavy use makes sex worse. So now let's move on to talking about alcohol's effects on the gastrointestinal tract and the liver. In general, heavy use is going to lead to fatty liver, and this is because of a buildup of triglycerides. So alcohol increases salivation. It does also increase the secretion of gastric fluid. Um, and that may explain why it enhances appetite and aids digestion, but higher concentrations can actually hurt the stomach lining. Chronic use can produce gastritis, which is inflammation of the stomach. But getting back to those triglycerides. So, one of the things that we know is that as triglycerides build up, your liver is normally going to metabolize fatty acid, but when alcohol is present, alcohol gets taken care of first, basically keeping the fat for storage. This is reversible, so if the drinking stops, those buildup of fatty acids and triglycerides will be reduced. But heavy use can lead to that fatty liver. A buildup of chronic acetaldehyde can actually cause alcoholic hepatitis. So basically, high levels of acetaldehyde will lead to inflammation of the liver, fever, yellowing of the skin, which is jaundice, and then finally, cells may die off. And this will produce cirrhosis. At this point, there's going to be scar tissue from those dead cells. As a result, blood flow is going to be cut off. Livers with cirrhosis are going to be very firm and hard to the touch. They may develop nodules that make them look like a pebbly appearance. And so to actually develop cirrhosis, it's highly unlikely. You would have to consume a ridiculous amount of alcohol for this to happen. And even with heavy drinkers, only about 10 to 20% actually end up developing cirrhosis. But we do actually find that the incidence of cirrhosis has increased. So here are fatty liver and cirrhosis. So here you can actually see a healthy liver. This is a liver that has fatty liver disease. It actually looks a little bit like pate or foie gras, which is a duck that has a duck's liver that has been force-fed fat. This is my reminder, you do not want your liver to look like foie gras. And this is a liver that has cirrhosis. It looks like a steak. It should probably not look like a steak. You can actually see some of the nodules and the areas of dead cells where these cells have basically been cut off from blood flow. You do not want either of these things to happen. Now, alcohol is also potentially damaging to a developing fetus. So we know that alcohol is a very simple molecule, and additionally, while the placenta is a tight barrier, it is not a complete barrier. And alcohol is actually capable of crossing through the placenta and entering the amniotic fluid of the fetus. So with fetal alcohol syndrome, alcohol very easily crosses the barrier of the placenta, and the fetus actually reaches the same blood alcohol concentration level as the parent. And this will lead to a lot of problems. So first of all, we will see developmental delays, potential intellectual deficits. The average IQ for somebody with fetal alcohol syndrome is about 68. They generally attain the average reading level of a fourth grader, the average math skills of a second grader. The motor milestones are delayed. There's poor motor coordination, language disabilities, slow response time. They have a very low birth weight. They may potentially have some neurological problems and may actually experience withdrawal symptoms like tremors and seizures. And additionally, they have very distinctive head and facial abnormalities. So they tend to have a small head, small wide-set eyes, with drooping eyelids. So you can see very heavy eyelids here, very short upturned noses. They do not have the obvious groove between the nose and the lip, the philtrum that most of us have. They don't really have that. And they also tend to have pretty small upper lips as well. Infants may also show low set, non-parallel ears, cleft palate, reduced growth of the lower jaw. You can actually see similar instances in mouse embryos. Here's normal development. You can see some of the issues with delayed development as well. They also may present with cardiac defects, possibly a hole in the heart, poor kidney development, undescended testes, and skeletal abnormalities. Now, when are these effects most likely to occur? And there are a lot of different factors that matter here. Because one of the things that we do tend to find is that a lot of people who are pregnant and are exposing their child to alcohol, they often also tend to have poor nutrition. They smoke cigarettes or other drugs. They tend to have poor prenatal care. And that's why animal research has been really beneficial. But we do know that other factors do matter here. For example, the amount of alcohol, the pattern of ingestion, as well as the developmental stage of the fetus. Generally, what we're going to find is that use during the 4th to 9th weeks of development produce the most formative damage and the most severe developmental delays. Now, this is really important because notice we're talking about the 4th week. Not everybody realizes that they're pregnant at 4 weeks. As a result, one of the things that is often recommended is that if you are trying for pregnancy or if you are planning on becoming pregnant, to not consume alcohol. And I do understand that other countries kind of have slightly different standards there. But remember, we're talking about high use here. The effects of low to moderate alcohol consumption on fetal development are less clear. And part of the other problem is that nobody wants to really actually test this experimentally. There are mixed effects there, so we're not entirely sure. Children whose mothers were light drinkers, like no more than 1 to 2 drinks per week, showed fewer problems in one 2009 study compared to those who were abstinent. And so there are a lot of different discrepancies. But in general, researchers and doctors are largely going to recommend that no alcohol should be had because any evidence that suggests that low levels of alcohol are safe, that might encourage women to drink more during their pregnancy, and that could lead to a lot of problems. So we kind of have to be a little bit careful there. So now let's talk about the chemical effects of alcohol. So alcohol is a very difficult drug to study. As I kind of mentioned, it's a very simple molecule. It passes through membranes very easily and rapidly, and as a result, it has widespread effects on the brain and the body. And we do know that there is a difference in the short term and the long-term effects that it does have on neurons. So let's talk about some of those now. So first of all, alcohol works on multiple neurotransmitters. It has both specific and non-specific effects. The non-specific effects are based on the drug's ability to pass through membranes. The specific effects are interactions with specific receptors. And alcohol works on both ligand-gated channels like neuron receptors, and they work on second messenger systems. So non-specific effects, we'll talk about those as well. So let's start by talking about alcohol and its effects on GABA receptors. So alcohol is a positive modulator for the GABA A receptor. So the more that you take alcohol over time, so basically in the short term, we're going to get some inhibitory effects. Over time, though, the more alcohol that you take, the number of GABA A receptors decreases. And the location of these GABA receptors is ultimately going to dictate a variety of different behavioral effects. We can look at GABA A receptors in the cerebral cortex, the hippocampus, and the thalamus, as well as in the nucleus accumbens and in the ventral tegmental area. And so we can kind of see here that alcohol, because it's a positive modulator for GABA, is going to be inhibitory in nature. It's part of the reason why alcohol is a suppressant. It does a lot of inhibitory effects. So if it does a lot of inhibitory effects, you might be able to predict what will happen with something excitatory like glutamate. And you thought right, alcohol use will temporarily inhibit NMDA glutamate receptors. So alcohol is an antagonist of glutamate. But the more alcohol that you take, so here, the more that you take alcohol, the GABA A receptors decrease, but the NMDA receptors will increase. It's trying to look for any activity that it can. So while we get a downregulation of GABA A receptors, we get an upregulation of NMDA receptors. Additionally, alcohol inhibits calcium channels, and this is going to be really critical. In particular, it's inhibiting what are called L-type calcium channels, and this is going to result in widespread effects. And these are going to be linked to decreased vasopressin. Vasopressin is a hormone that's kind of critical for hydration, among other things. So we know that alcohol has dehydrating effects. But in addition to this, the disruption of these calcium channels will impair cognition. It will hurt our ability to get a good night's sleep. We've already talked about the fact that it inhibits REM sleep, so we don't get that REM sleep that we need. Because it's a vasodilator, we get low blood pressure, and we will get enhanced aggression. There are some other neurotransmitters that it works on as well. Alcohol increases serotonin in the nucleus accumbens, and it does seem to have interactions, though we're not quite sure what kind, with the endocannabinoid system. So now let's finish up by talking about alcoholism. So when we talk about substance use, remember that any type of substance use disorder is a biopsychosocial issue, and alcoholism is no different. It is a multi-factored problem, and this makes it very difficult to define, and it makes it difficult to treat. And this is associated with a lot of different negative effects. So obviously there's going to be some financial cost, maybe medical treatments or car accidents or things like that. You're not going to be able to hold down a job easily. It's going to reduce your productivity. It could potentially hurt your relationships with family members. And we know that there are criminal effects that can happen. Many people who struggle with alcohol may experience DUIs, DWIs, public intoxication charges. And we also know that alcoholism is linked to a lot of different violent crimes. So how do we determine if somebody is an alcoholic? Is it somebody who drinks alone a lot? Some people live alone. If I have a glass of wine and I live alone and I have a glass of wine each week, does that make me an alcoholic? Maybe, maybe not. Is it somebody who drinks in the morning? Well, maybe, but it could also be somebody who's working night shift and our morning is their evening. It's their happy hour. Is it somebody who drinks more than I do? Well, I very rarely drink, so apparently anybody who has even one is. So we've got these really fuzzy definitions. Is it somebody who drinks all day? You can ask these kind of questions, but the definition of whether or not somebody is an alcoholic is kind of fuzzy. I think we can go back to our general rule for addiction and say, if they realize that this is causing problems in their life and they try to quit, but they can't, that craving and that relapse, that might potentially be a marker of a substance use disorder. And maybe it's not helpful to focus on these kind of questions. So what sort of things do we have to take into consideration? Let's be clear. The amount you consume is definitely part of it. If you are drinking a 12-pack every day, that might be a problem. But you also have to consider how frequently people use and how their general pattern of use as well. So we have to define binge drinking. Binge drinking is defined as having 5 drinks in a row or more. And one thing that we're going to be clear about is that there is no typical alcoholic. There's an estimated 10% of Americans who have an alcohol use disorder, and about 10.5 million adults have a dependence. Now, it is more common in men than it is in women. However, that gap is closing. So one of the things that we do see, this is from the New York Times from 2024, and of course they won't let me pay for it, but the headline basically was saying that women are starting to report more alcohol-related problems due to increased drinking due to the pandemic, and it's potentially starting to match, and in some cases even outpace men. Now, there is a part of me that thinks that this is a little bit hand-wringing in nature, because the data does show that binge drinking is really the critical problem, and men still binge more. Having said that, though, alcohol can cause a lot of problems regardless of your gender or your sex, and because of that, it's important to be mindful of how much you're drinking and whether there are problems. And one of the things that we do find in particular, the biggest group that we are generally concerned about with alcohol use disorders are college-age adults like yourself. So the drinking age is 21, which means that a lot of college students are beginning to drink. Now, let's be very clear. College students also drink underage. And I know that that happens. Like, I don't live in a fantasy world where nobody drinks until they're 21. I know that underage drinking happens, but because there hasn't really been an opportunity to really educate people about alcohol besides saying it's bad, don't do it, you kind of get a little bit of kind of going way too far in the other extreme once you are allowed to have it. And there are a lot of high profile cases of especially those associated with fraternities where there's this drinking culture, particularly a binge drinking culture, where people have died of alcohol poisoning through hazing rituals and parties and things like that. So college age adults are where these problems particularly tend to lie. Now, there are multiple factors that contribute to alcohol abuse. So we have our biological factors like our genetics and our unique neurochemistry. We have psychological factors, different personality traits, whether or not you are encountering stress or other vulnerabilities, as well as whether or not you're the type of person to seek novelty. And then we have some sociocultural factors. Group attitudes really play a role, as does accessibility. So we'll talk about each of those now. So what sort of psychological factors ultimately affect one's propensity to develop alcohol abuse? Generally, stress is one of the biggest vulnerabilities. Generally, you are more likely to use if you believe or you feel that alcohol reduces tension. So for example, an individual who no longer drinks on a social occasion, but they drink every day after work to relieve the tension from work, that is somebody who is drinking in a very problematic way. So sometimes this term is called symptomatic drinking, basically the reinforcing effects of alcohol when stress and tension are relieved. Generally, what's interesting is that acute stress, so short-term stress, actually reduces alcohol consumption. It's chronic stress that really enhances and basically increases alcohol consumption. Additionally, if you have a history of stress in your early development, that also will potentially make you more likely to drink as a result. Additionally, there are some associations with lifetime anxiety. So that I kind of mentioned this notion of self-medication. Generally, if you are somebody who is way too tense, you're way too on alert, like somebody with anxiety might be, alcohol abuse is actually more likely. Another significant factor is family history. First of all, that's associated with greater cortisol responses following psychological stress. So if you have this family history of stress, that can be an issue. Additionally, differences in your stress response system, so how you uniquely respond to stressful situations, may play a role. And then additionally, there's novelty seeking. So novelty seeking is basically you wanting to try new things. And generally, people who need novelty or need to be stimulated are going to be more likely to abuse alcohol. Additionally, low harm avoidance, like somebody who's not interested in avoiding harm, might be more likely to engage in alcohol drinking and potentially abuse it. Now, what sort of biological factors affect it? So again, we have some, generally this is related to family history. If you are a close relative of an alcoholic, you have a 3 to 7 times greater risk for alcoholism than the general population. We also know that there are some genetic vulnerabilities. Additionally, having a low sensitivity to alcohol can play a role. Generally, people who struggle with alcohol abuse, they frequently report that they feel very little effects of alcohol unless they drink really large amounts. So they're metabolizing it. Potentially much more quickly, and they don't really feel a lot of acetaldehyde being built up. And additionally, there could be genes that are involved both in liver metabolism as well as neurotransmitter metabolisms. Now, what sort of social factors will affect it? So one of the things that we know is that in general, cultures that abstain or restrict alcohol for religious reasons do tend to have lower rates. So generally, 2 religious groups that have very low rates of alcohol abuse are Muslims and Mormons. Those are 2 groups that actually have religious prohibitions on use. Now, additionally, there are higher rates if social drinking or drinking to reduce tension is condoned, such as here in the United States where we have happy hour. And then finally, I want to talk about a really interesting case, Italy and France. These are 2 Catholic countries, and they produce and consume large quantities of alcohol. France actually has one of the highest alcohol abuse rates in the world, and Italy really doesn't. And so the question may be why. And this is a case where social customs come into play. In France, they don't really frown on people being drunk. They don't think it's distasteful to see somebody drunk. And generally, if you refuse alcohol, the French culturally consider that impolite. Now, Italy is a little bit different. They disapprove of drunkenness. They drink, but they really don't like seeing people out in public being drunk. They accept abstinence, and it's okay to turn down somebody's offer of alcohol. And generally, that cultural difference leads to those differences in alcohol abuse rates. It's all about how does your culture feel about drunkenness, and how does your culture feel about abstaining from alcohol or turning down somebody's offer from alcohol? Now, there are multiple forms of rehabilitation, but there are always going to be some hurdles anytime that you are dealing with substance abuse, and alcohol abuse is no exception. So first of all, you're going to have to deal with denial. Generally, these folks will often fail to recognize that alcohol and their alcohol abuse is a major problem. And additionally, this denial is going to be aided by family members and friends who are often going to enable them, often by repairing the damage that's caused by the drinker or making excuses for their behavior. So they basically are allowed, like, and we have to be careful with the language around enabling because it feels a little like, well, it's your fault. But it does make it harder to treat the problem if there are people who are basically cushioning the person who's abusing from experiencing the consequences of their actions. So oftentimes the goal is you're often going to have somebody get into treatment, and oftentimes it's going to take rock bottom situations like threatening divorce, losing children, loss of employment, the legal system, and so on. So the first step is detoxification, because withdrawal is a really strong motivator. Remember, there's a physical dependence here, and drinking prevents those withdrawal symptoms. And additionally, withdrawal from a depressant like alcohol is really dangerous. We don't want somebody to quit cold turkey. And here's where the cross tolerance that alcohol has with benzodiazepines and barbiturates is actually really helpful. Detoxing is basically going to give you're going to give somebody a benzodiazepine like Valium to basically prevent alcohol withdrawal. And they're also longer acting than alcohol is. So that gives the individual an opportunity to really be stabilized, gradually reduce those withdrawal symptoms. At that point, you're going to want to do some type of psychosocial rehab. In this case, you are going to help the person prevent relapse through abstinence, or to reduce the amount of alcohol consumed if there is a relapse. This may include individual and group therapy, residential programs, groups like Al-Anon, and unfortunately, the relapse rate is really high. Basically, back in 1996, it was estimated that between 40 to 70% resumed drinking after 1 year. Additionally, we can do pharmacotherapeutic therapies. Basically, this involves two different components. First, we're going to make alcohol unpleasant, and we're going to reduce its reinforcing abilities. So oftentimes you are going to give somebody something like disulfiram, which is sold under the trade name Antabuse. And basically what it does is it inhibits acetaldehyde dehydrogenase. As a result, when somebody drinks alcohol while they're on this drug, acetaldehyde builds up and causes those unpleasant experiences that we talked about, like facial flushing, tachycardia, vomiting, nausea. And it's the goal of this drug is to make drinking unpleasant. Now, disulfiram can cause hepatitis. So you are going to have to get tested for your liver function. So that's one possibility. Another possibility is naltrexone. This is an opioid. It reduces alcohol consumption and craving, and it basically blocks the effects of alcohol-induced endorphin release. So we didn't talk about a lot of neurotransmitters here, but alcohol works on a variety of different neurotransmitter systems. Opioids is one of those. So naltrexone can be taken to basically reduce the high that drinking alcohol gets you. And again, all of these things that I'm talking about, there's still a very high relapse rate. So you can kind of see here for naltrexone, we have the percentage not relapsing over time. And you can see that in general, naltrexone with therapy has a better rate than a placebo with therapy. But you can see even with this drug that is beneficial, you are going to get a certain percentage of people who will relapse within the year. So folks, this is all I had for this week. Next week, we are going to talk about opioids and other drugs, and I will see you next time. Bye.